Welcome to this informative video where we explore the fascinating world of doctors and their specialities. Each doctor plays a unique role in diagnosing, treating, and guiding us toward better health. From the common cold to complex surgeries, there's a medical expert trained specifically for your need. Let's dive into the various types of doctors and understand how they serve us. Let's begin with the general physician, also known as a GP or family doctor. These are the doctors most people visit first when they feel unwell. They treat a wide variety of illnesses including fever, cough, flu, body aches, and infections. They also manage chronic conditions like diabetes, hypertension, and asthma. Importantly, if they suspect something serious, they refer you to a specialist. They are the foundation of primary healthcare and offer preventive checkups as well. Now let's talk about pediatricians, the doctors for children. They specialize in the health and well-being of newborns, infants, toddlers, and teenagers. Pediatricians give vaccinations, monitor physical and mental growth, and handle childhood illnesses. They are also trained to recognize developmental delays or behavioral concerns early on. A good pediatrician supports both the child and the parents through every stage of growth. Next up are cardiologists, the doctors who take care of your heart and blood vessels. If you have chest pain, shortness of breath, high blood pressure, or irregular heartbeat, a cardiologist is the right doctor to visit. They perform tests like ECG, stress tests, and echocardiograms to check your heart function. They manage heart diseases, prescribe medications, and may suggest procedures like angioplasty. Preventive care from a cardiologist can reduce the risk of heart attacks and strokes. Neurologists specialize in the brain, spinal cord, and nervous system. They handle conditions such as seizures, migraines, stroke, multiple sclerosis, Parkinson's disease, and memory loss. If you experience symptoms like dizziness, numbness, weakness, tremors, or sudden confusion, a neurologist should be consulted. They use tools like MRI and nerve conduction tests to detect neurological issues. Their work is crucial in maintaining the brain's functionality and improving quality of life in chronic conditions. Dermatologists are doctors who deal with the skin, hair, and nails. They treat acne, rashes, fungal infections, eczema, psoriasis, and skin allergies. They also diagnose and treat skin cancer and perform minor surgeries to remove moles, warts, and cysts. Cosmetic dermatology involves treatments for pigmentation, wrinkles, and hair loss. Healthy skin is not just about beauty, it's also about detecting internal health problems early. Psychiatrists are medical doctors who specialize in mental health. They treat conditions such as depression, anxiety, schizophrenia, bipolar disorder, and obsessive-compulsive disorder. Unlike psychologists, psychiatrists can prescribe medications and monitor their effects. They help patients understand their thoughts and behaviors, offering therapy and support. In a world where mental health is often ignored, psychiatrists play a vital role in emotional well-being. Gynecologists are experts in women's reproductive health. They handle menstruation issues, pelvic pain, contraception, fertility challenges, pregnancy, and menopause. They conduct important screenings like pap smears, breast exams, and ultrasounds. They also manage gynecological surgeries like hysterectomy or fibroid removal. Routine visits to a gynecologist help in early detection of potential problems. Urologists treat diseases of the urinary system and the male reproductive system. They manage kidney stones, urinary infections, bladder issues, prostate enlargement, and male infertility. Men with erectile dysfunction or difficulty urinating often need to see a urologist. They perform procedures such as cystoscopy, prostate surgery, and stent placement. Women with incontinence or pelvic floor disorders may also benefit from a urology consultation. Orthopedic doctors are specialists of the bones, joints, and muscles. They treat fractures, arthritis, dislocations, spinal issues, and sports injuries. They may recommend physiotherapy, medications, or surgical procedures like joint replacement. They help restore movement and reduce pain, especially in aging populations. Some orthopedists specialize further in areas like spine surgery, hand surgery, or pediatric orthopedics. ENT specialists, or otolaryngologists, focus on problems related to the ear, nose, and throat. They treat chronic ear infections, hearing loss, sinus problems, throat pain, and voice issues. They perform surgeries like tonsil removal, nasal polyp removal, and ear tube insertion. They also help with snoring and sleep apnea. Their work ensures that your senses of hearing, smell, and speech are working properly. Ophthalmologists are medical doctors who specialize in eye and vision care. They diagnose and treat eye diseases such as cataracts, glaucoma, diabetic eye disease, and infections. They can perform surgeries like LASIK or cataract removal. They also prescribe glasses and contact lenses. Routine eye exams can prevent vision loss, especially for people with diabetes or high blood pressure. Dentists take care of oral health, teeth, gums, and mouth. They treat tooth decay, gum infections, toothaches, and perform root canals and extractions. They also offer cosmetic procedures like teeth whitening, veneers, and braces. Good dental hygiene reduces the risk of heart disease and diabetes too. Visiting a dentist every 6 months is highly recommended. Gastroenterologists treat diseases of the digestive system. They deal with stomach pain, indigestion, ulcers, acid reflux, constipation, diarrhea, liver problems, and hepatitis. They use procedures like endoscopy and colonoscopy to visualize and treat the digestive tract. They also help manage chronic conditions like Crohn's disease and irritable bowel syndrome. A healthy digestive system is essential for overall energy and well-being. Pulmonologists are lung specialists. They treat asthma, pneumonia, chronic obstructive pulmonary disease, COPD, tuberculosis, and other breathing issues. They help patients manage oxygen therapy, inhalers, and ventilation support. They also treat long-term effects of COVID-19 on the lungs. Pulmonologists ensure your respiratory system functions at its best. Oncologists are doctors who treat cancer. They manage different types of cancer such as breast, lung, colon, and blood cancers. They coordinate treatment plans involving chemotherapy, radiation, and surgery. They also provide palliative care and emotional support during cancer treatment. Early diagnosis and a strong oncology team can greatly improve survival rates. Endocrinologists are hormone specialists. They manage conditions like diabetes, thyroid disorders, obesity, PCOS, and growth issues. They help regulate hormones that control metabolism, mood, reproduction, and energy levels. They interpret complex tests like hormone panels and glucose tolerance tests. Their guidance is essential for managing lifelong hormonal diseases. Nephrologists are kidney specialists. They treat chronic kidney disease, kidney failure, electrolyte imbalance, and high blood pressure. They supervise dialysis and help patients prepare for kidney transplants. They monitor kidney function in patients with diabetes or hypertension. Healthy kidneys are vital for removing waste and balancing body fluids. Rheumatologists focus on autoimmune and joint disorders. They treat diseases like rheumatoid arthritis, lupus, gout, and ankylosing spondylitis. They manage pain, swelling, stiffness, and fatigue that affect quality of life. They use lab tests and imaging to diagnose and track inflammation. Their treatment helps reduce joint damage and improve mobility. Surgeons are doctors trained to perform operations. They remove diseased tissues, repair injuries, and correct deformities. Surgeons may specialize in general surgery, heart surgery, brain surgery, or plastic surgery. They work with anesthetists and nurses in the operation theater to save lives. Their precision and skills make critical treatment possible. Anesthesiologists are the silent protectors during surgery. They administer anesthesia and monitor vital signs throughout the procedure. They ensure the patient feels no pain and remains stable during operations. They also help manage chronic pain through injections and nerve blocks. Their role is essential but often unnoticed. Radiologists interpret diagnostic images. They analyze X-rays, MRIs, CT scans, ultrasounds, and mammograms. Their findings guide surgeons, physicians, and oncologists in planning treatment. They also perform image-guided procedures like biopsies. Radiologists are key in early detection and accurate diagnosis. Pathologists study samples of blood, tissue, and urine to identify diseases. They diagnose infections, cancers, autoimmune diseases, and more through lab testing. Their work happens mostly behind the scenes but is crucial for diagnosis. Every biopsy or blood report is carefully reviewed by a pathologist. They are the scientific backbone of clinical medicine. In conclusion, each type of doctor plays a vital role in keeping us healthy. Understanding what each specialist does can help you seek the right care at the right time. Whether it's a mild symptom or a serious illness, there's a doctor trained to help you. Don't ignore symptoms, your health deserves attention and expertise. Thank you for watching. If you found this video useful, please like, share, and subscribe to our channel. Let us know in the comments which type of doctor helped you the most. Stay informed, stay healthy, and see you in the second part of the video.